Conquering incontinence, more than just diapers.
Welcome everyone. Today we are discussing a topic that might be sensitive for many, but nonetheless, it's crucial to talk about: incontinence. You may think the only solution is wearing diapers, but let me assure you, there are several ways to manage and even overcome this condition.
What is incontinence?
Incontinence refers to loss of bladder control, causing unwanted leakage of urine. It's not just a part of getting older, but a health issue that requires attention and can often be treated effectively.
Lifestyle changes.
The first line of defense for managing incontinence often involves making changes to your lifestyle. These may include fluid and diet management, regulating fluid intake and avoiding irritants like caffeine, alcohol, and acidic foods can decrease urgency and frequency. Bladder training. This involves scheduling bathroom visits, rather than waiting for the need to go. Gradually, the period between visits can be increased. Pelvic floor exercises. Commonly known as Kegel exercises, they strengthen the muscles which support the bladder, enhancing urinary control.
Medications.
There are several medications that can help manage incontinence, such as anticholinergics. They calm an overactive bladder. Topical estrogen. Applied to the vaginal area, it rejuvenates tissues and can help reduce incontinence. Alpha blockers. Often used in men, they help with bladder control by relaxing the muscles. Always consult your healthcare provider for the most suitable medication for your condition.
Medical procedures.
If lifestyle changes and medications aren't enough, medical procedures can be an effective solution. Nerve stimulators. A device is implanted under the skin that sends gentle electrical pulses to the nerves influencing bladder control. Bulking material injections. Material is injected around the urethra, helping keep it closed and reducing leakage. Surgery. Several surgical procedures can help, depending on the cause and type of incontinence.
Devices and products.
Apart from diapers, there are several incontinence products and devices available. Pads and protective undergarments. More absorbent than regular menstrual pads, they protect against urine leakage. Catheters. In more severe cases, a catheter might be used to empty the bladder. Pessaries. These are devices inserted into the vagina to prevent urine leakage. Incontinence might seem daunting, but remember, you're not alone, and there are multiple treatment options available. Discuss your symptoms openly with your healthcare provider, and together, you can devise a treatment plan that suits your lifestyle and needs. Remember, incontinence is not a condition you need to simply live with. It can be managed, treated, and often significantly improved.